When do we first get teeth? When do our adult teeth arrive? How do our baby and adult teeth differ? In this video, we will answer all of these questions as we take a closer look into the development of teeth. Not only do our teeth have roles in chewing, but they also impact our speech and are of particular aesthetic importance. The first time our teeth see the light of day is around the 6 months mark. This marks the beginning of the continuous eruption of our primary dentition, or baby teeth, which takes place over a 2-year period. The first teeth to make an appearance are the lower central incisors. After the lower centrals, the lower lateral incisors appear at 7 months, with upper central incisors and upper lateral incisors erupting at 7 and 8 months respectively. Next up, our first primary molars at 12 months, and then our primary canines at 16 months. Finally, the second primary molars at 20 months are the last baby teeth to take their place in the mouth. There are several distinct features that are seen in the primary dentition. In the early stages of a child's development, the tongue plays an important role in shaping the dental arches. Some of the features you may see include spaced anterior teeth, primate spaces, a shallow overjet and overbite, a class 1 molar relationship, lower second molars that are longer than the upper second molars, and vertically inclined anterior teeth. Looking specifically at how the anatomy of the baby teeth differs from the adult teeth, our baby teeth tend to be more bulbous, have more divergent and thinner roots, and the pulp of the baby tooth is relatively larger compared with the adult tooth. Baby teeth tend to have a flatter and broader contact point between each other. Perhaps the most important difference between baby and adult teeth, however, is the fact that we want the roots of baby teeth to resorb, leading to the loss of the baby teeth to make way for our adult teeth to erupt. Consider this. The combined width of the adult incisors is 7.6 mm greater in the upper arch and 6 mm greater in the lower arch than the primary or baby incisors in each jaw. How do the adult teeth fit into the smaller space left behind by these baby teeth? There are a few answers to this. Firstly, the spacing between the baby teeth means that although the baby teeth are smaller, they don't have to strictly occupy a space equivalent to their width. Secondly, as we grow, the width of our dental arch can increase, creating more space for our adult teeth. Finally, the adult incisors display more labial inclination as opposed to the vertical inclination of our baby teeth. This means the tips of the adult incisors lean slightly forwards, which creates slightly more space too. Another way in which we gain space for our adult teeth is through a concept known as the leeway space. Since the combined width of our primary canine and primary molars is greater than the combined width of our adult canine and premolars, the teeth that erupt into the spaces left behind by the primary canine and primary molars, there will be extra space left over which can be utilised by other adult teeth erupting nearby. So when do our adult teeth arrive? It begins with the lower central incisors at the age of 6 years. Accompanying them, our first permanent or adult molars arrive. We then see our lower lateral incisors erupt, and soon after our upper central incisors too, both at the 7 years mark. At 8 years, the upper lateral incisors erupt. The lower canines erupt at 9, and our first premolars follow swiftly behind at age 10. 11 years old sees the second premolars and upper canines take their place in the mouth. At 12 years old, we gain our second permanent molars, and between the ages of 16 and 20, we might see our third permanent molars, better known as our wisdom teeth. This video has explained the chronology of tooth eruption. Which topics would you like me to cover next? Leave a comment below. Subscribe if you're new. Thanks for watching, and I'll see you in the next one.